Hi, so I chose to do my presentation on a case study, and the case study scenario is disability identity, and I'm Catherine Walker Marshall. The disability identity scenario is for a client who is a 22-year-old female. The client has a disability that was diagnosed at age 11 called a tethered spinal cord. The condition caused weakness in leg collapsing and difficulty walking, and that's how this condition was realized. So at age 11, at track and field, this is when the first symptoms of the disability started to show. After the symptoms and the disability was diagnosed, there was surgical intervention that was required. After this, the client had difficulty keeping up with classes as she missed frequently for appointments. She had peers questioning her absence in classes, was falling behind, and did not receive any accommodations for her new diagnosis, and also had fears of being different and failing academically. So then we're going to look at age 18. So later, same client. So this client at age 18 started college and then had internal conflicts about her disability identity due to having a disability identity. She did not receive accommodations while she had the legal right to use them, was often told she was not disabled enough to use them, and had a lot of pushback and discrimination whenever she tried to use these accommodations that she had through her college administration. She stopped using any accessible equipment at this point and had an invisible disability, which an invisible disability is, to the unseen eye, cannot tell that there is any difference in walking, no disability at all. She also felt like she did not fit into the able world or the disability community, and hid her disability from many friends and had fears of judgment or discrimination she may experience if loved ones knew about her disability. So that was age 18. So when you look at this case study, there's three major presenting issues. The first one being the client's difficulty of acceptance of her disability, and the second being client's social fear of rejection and isolation, and third, the client's fear of not being able to accomplish her social and academic expectations with her disability. So when we look at the stages of Erik Erikson's psychosocial development, specifically industry versus inferiority. So at this age, the children are usually around 7 to 12 years old, begin to ask themselves the question of, can I make it in the world of people and things? The children at this stage begin to have feelings of desire to succeed and make their path along with feelings of fear of inferiority, failure, and incompetence. The client is stated to have been falling behind in her classes as she was not given accommodations for her disability. The client is in the psychosocial stage of development, wanting to be successful in her classes, though has the obstacle of learning to adjust to her new needs and new ability level. As stated in the case study, the client is missing work due to having to miss class for appointments or health flare-ups, and having to kind of play a game of catch-up during some car rides and appointments by completing assignments when she has the time to do so. The experience of falling behind because of health issues and doctor's appointment would cause the client to start to have feelings of failure, inferiority, and incompetence at this stage of development. So this client would be experiencing some of those fears of that question, can I make it in the world of people and things, and would be starting to have fears of her disability making her not be able to make it into the world of people and things. In the next stage, Erik Erikson's psychosocial development, identity versus role confusion. In this stage, the adolescent would be concerned with how they appear to others and begin to kind of explore their beliefs in order to achieve an identity that fits into the adult world. So in the case study, the client is experiencing some of these feelings of not feeling like she fits in and not feeling like her identity of a disability is accepted. So this would be her trying to find a sense of how she fits in and how her disability plays a part in her whole sense of self. The experiences she had with discrimination of people asking why she walks different, not being accepting of her accessible equipment, the lack of accommodations, and being told she's not disabled enough because she had a disability identity would all cause her having difficulty accepting her identity, thus making this stage more difficult. The client's experience of having difficulty fitting into the able world and the disability community are part of this psychosocial development that the client is trying to make methods of accepting her new identities. In the stage Eric Erickson's psychosocial development, intimacy versus isolation, in this stage the client would be experiencing a desire to be loved and cared for. In the study, she's experiencing fears of being accepted and thus loved. The client is hiding her disability from loved ones in her life so that she does not face rejection, discrimination, or harm due to her new identity. She is isolating herself and important parts of who she is from her loved ones in life so that she can fit in and experience community in this stage of life. The client is fearful of being rejected of her true identity, so she chooses to hide her identity and blend her identities with those around her, which fits into the stage of intimacy versus isolation. She is making sacrifices of her needs and potential accommodations to have intimate relationships, though is causing isolation in parts of her life. This choice to hide her identity so that she can be loved and not face some of the past discrimination ultimately is causing her isolation in parts of her life. So when we think of Maslow's hierarchy of needs and all the different stages and tiers, specifically when we look at tier 2, this would be the tier of belongingness and love needs, which would be relationship security, intimacy, connectedness. The client is withholding information about herself so that she can be in relationships with people without fears of rejection or isolation. The client's actions to hide her identity of having a disability and her choice to not receive accommodations in her relationships so that she can not be rejected fits into this tier specifically. The love and belongingness needs need to be met, withholding information about her health needs so that she can be in relationship with those without fear of rejection. This ultimately is also causing her isolation. She is placing the needs of intimacy, friendship, affection, love, connectedness as a high valued need. This social drive and emotional need for interpersonal relationships is evident at this stage, and this placing of the need of intimacy above her accommodation is causing some presenting issues. So when we think about the adolescent age, some treatment options would be the first step that would be essential would be getting connected with some of the faculty at the child's school, specifically the intervention specialist, the school counselor, as I'm a clinical counselor, the classroom school teachers, and the principal. It would be imperative that the child started to receive some accommodations within that classroom as she's falling behind due to those appointments and due to her disability needs. So initially what would need to happen is coordinating with school faculty to get a 504 set up for proper accommodations, whether that be for the missed work and also potential other needs for accommodation. And then some other things that would need to happen from the clinical counseling side would be some goal setting for the social and academic and physical adjustments and transitions that would be occurring due to her new diagnosis. So that goal setting would be how she would plan to transition in those relationships and those physical needs. And I would likely use brief counseling and some motivational interviews and interventions techniques to set up goals with the new client's transition. And I would focus on the following, these kind of issues. So this would be relationships she had, the transitions required, her disability needs to be met. So whatever that would look like in all of the areas of her life, academic, social, physical. And her personal view of her new normal ability levels and her new normal relationships, just her new life of after transitioning and accepting that disability. And I also think it would be imperative to provide the child with resources, maybe that be books or just academic resources that are age appropriate, that would kind of discuss what a disability was and what a disability identity and disability culture and community were. And I also believe that getting the child some resources and the family some resources of other children with disabilities, whether it be similar disabilities or other disabilities in the area. When we think about the treatment maybe for more of the college age that was stated in the case study, the primary issue that I believe would need to be addressed is the client's view of herself. So the client is experiencing issues due to hiding her disability and due to the past experiences of discrimination and her desire for intimate relationships. I would provide the client with resources for accommodations at college as she experienced past issues with accommodations. I think it would be important to make sure the client had accommodations at college as well. I would also do individual counseling focused on her focused on identity development and reservations she had surrounding accepting and sharing information to loved ones about her disability. Because I believe at this stage, the intimacy needs that she has of wanting to be loved and in relationship with people would be important to address that identity development and also that sharing of information about her identity of having a disability. I would also like to hone some of her skills of self-regulation and the manner of her intimate relationships and also with the accommodations of her disability. I would also encourage her to become more involved in any campus-based or community opportunities for students with disabilities to form some of those intimate relationships she's looking for with some of those peers. And that's all I have.